A federal judge has tossed a lawsuit by drug companies who claim that the new Medicare drug price negotiations aren't legal. This is a rare victory for consumers. It's not a huge victory. That's the word. We have to claim victory where we can.
Right.
You understand, we're only talking about 10 drugs. There are 3,000 or more drugs, okay, out there. And we're talking about 10 drugs.
Right.
That the administration just happened to pick. What about the other 3,000 drugs where price gouging is so serious that there's 5,000% increases? That marked up 5,000%. And the company says, oh, well, we had to do that for R&D. Bullshit. They didn't have to do it for R&D. They did it for advertising. That's why you have an ad on every 9 seconds on TV.
Right. And as the high prices impacts taxpayers all over the place. You look at what we pay in Medicaid and Medicare. You look at what cities are paying for medication. You look at all the clinics, how it's impacting across the spectrum there. Also, what's happening to the drug companies is they're getting more linear in how they're controlling more parts of their market than they ever did before. They're heavily into the pharmacies. They're heavily, they're supposed to be 340B money is money they're supposed to be as it sell to a discount to federally managed healthcare clinics, and that money's supposed to go back and help fund healthcare, and they're keeping the money.
Yeah.
And nobody's going to call them out on it. No legislator is going to look at it.
How many articles on corporate TV have you seen where they say, let's talk about drug markup? Let's show you this drug where there's a 2,000% markup.
Right.
Let's show you insulin where it costs them $7 to make, but it's going to cost the user $250 a month to get. Let's talk about that. Why don't they do it? Because every 10 seconds, every 9 seconds, every 8 seconds sometimes, there's an ad on television talking about drugs being paid for by the pharmaceutical industry that's increasing the bottom line for corporate media's TV.
And the people that are hurt don't have advocates. They don't have anyone there going in front of the lawmakers. And they're not contributing to the campaigns, but this is impact. I mean, Mike, we're looking at, this is a kitchen table issue with a lot of families. If they're living paycheck to paycheck, the price of insulin, someone had to make a decision to buy that insulin or food.
I've had to sue the industry right now. I've got a case pending against the industry on price fixing. I've never seen better documents. I mean, it's just like it's like the documents are overwhelming. But in this situation, Rick, you've got an entire industry that they're upset that 10 drugs are being looked at. 10 drugs. Right. They understand that if they have to come down on the price of one of those 10, they've got thousands that they can make up for. But they're spending millions, tens of millions of dollars on lobbyists because their point is Pfizer and Merck and Johnson & Johnson, their point is, oh my God, if we let this pass, what's going to happen next?
Right. They're worried about the peak under the curtain. That we're going to really understand how much they're overcharging us on so many different drugs.
Yeah. Well, even, Bernie Sanders, who I'm a big fan of Bernie, Bernie says, what does this legislation really do? Right. We're talking about 10 drugs, but they can't even take that. We've had 2 victories. This one, and then last year there was a victory on a similar issue. And we got to win on something. Consumers have to win on something where it comes to these drug prices.
And people need to follow the insulin case that y'all are working on because that's a really dramatic difference here because that patent was donated. Yeah, it should be no cost involved.
A Canadian doctor said, I'm going to give this to you free.
Right.
And all of a sudden you've got Lilly making $250 every time somebody says, I have to have this to live.
Right.
I have to have this to live.
Right.
And people are having to cut their insulin in half
or
just so they can afford it or go without food or go without, place to live.